After the age of 70, many men like you believe that keeping up with medical checkups is the smart and responsible thing to do. And in many ways, it is. But what if I told you that some of those routine tests, yes, the ones recommended by well-meaning doctors, could actually do more harm than good? It might sound shocking, even unthinkable, but it's a truth buried deep within medical studies that rarely make the headlines. You see, millions of seniors across the country go through these checkups every year, not realizing that some of them may lead straight to surgeries, medications, or complications that weren't needed in the first place. In fact, recent research shows that up to 37% of tests given to older adults result in unnecessary treatments or lifelong side effects. And what's even more surprising, nearly every man over 70, 99%, has no idea this is happening. One of these tests, the most dangerous on our list, has been linked to up to 5% of all cancers in the U.S. That's the same risk as drinking alcohol every single day. And yet, it's being marketed as preventive care. But don't expect to see this on a poster at your clinic or on the evening news. Today, I want to help you see through the noise and take back control of your health. In this video, I'll walk you through 5 medical tests that many men over 70 are better off avoiding and explain why the risks can quietly outweigh the benefits. Every insight I'll share is backed by solid science, real-life patient stories, and over 3 decades of clinical wisdom. I promise you, number 2 on this list will make you pause. Before we dive in, I'd love to know, where are you tuning in from? How old are you? And have you ever gone through a medical test you later regretted? Drop a comment below. We read everyone and respond with personalized advice to help guide you. Also, don't forget to like this video and subscribe for more empowering science-backed content just for men like you. Now, let's begin with a test that seems completely harmless, but often does more damage than good.
Checkup number 5. Bone density scans. The silent overreaction. Let's start with a scan you might already be familiar with. The bone density test, also known as the DEXA scan. It's quick, it's painless, no needles, no fasting, just a scan that tells you how strong your bones are. So, what could possibly be wrong with that? Here's the part most doctors won't tell you. After 70, these tests often cause more fear than benefit. That's because some level of bone thinning is perfectly normal at this age. Just like getting gray hair or wrinkles, it's part of the natural aging process. But when a scan comes back showing osteopenia, which simply means mild bone loss, many men are rushed into medications that may not be necessary and could actually hurt them. The most common drugs prescribed after a DEXA scan are called bisphosphonates. They're intended to strengthen bones, but they often come with serious side effects: stomach irritation, jawbone problems, and even strange types of bone fractures. And here's the kicker. Studies show these medications barely reduce fracture risk in older adults. One study from the Journal of the American Geriatric Society tracked more than 1,200 women over 70. The medications lowered fracture risk by only 0.3% over 5 years. That's barely a sliver of benefit. But the side effects? Those were anything but minor. Let me tell you about Rose, a 76-year-old retired piano teacher. She never had a fall, walked every day, and felt fine. But during her annual checkup, her doctor suggested a DEXA scan. The results came back showing mild bone thinning, not osteoporosis, just osteopenia. Still, she was prescribed a bisphosphonate. 3 months later, she developed severe reflux, jaw pain, and had to stop playing piano. It broke her heart. When she came to our clinic, we stopped the medication and focused on lifestyle instead: vitamin D, resistance training, and a calcium-rich diet.
A year later, Rose was back to playing piano with stronger legs and no fractures. The truth is, for seniors who haven't had recent falls or fractures, lifestyle is the smartest strategy. Studies show that weight-bearing exercise, proper nutrition, and treating vitamin D deficiency can reduce fracture risk by more than 20% without any scary side effects. So, if your doctor suggests a bone scan after 70 and you're feeling well, it might be worth asking, is this really necessary? Because the next test on our list can lead to something even more serious than bone medication: brain surgery.
Checkup number 4, brain MRI for memory loss, when curiosity becomes a cascade. Now, let's talk about something that triggers deep fear in many seniors: memory problems. You forget a name, misplace your keys, walk into a room and forget why. Naturally, your mind goes to the worst. Is this the beginning of dementia? In response, many doctors immediately order a brain MRI, hoping to offer clarity or rule something out. But here's the uncomfortable truth: MRIs almost never tell us what we're hoping to find. Instead, what they often show are normal, age-related changes in the brain. Things like small white matter spots or mild shrinkage that appear in most people over 70. These findings are rarely dangerous, but the moment they're spotted, they can trigger a chain of events: fear, follow-up tests, and sometimes unnecessary surgery. A 2021 study published in Neurology Today looked at over 3,000 seniors who had mild memory concerns. About 86% of their MRIs showed some kind of brain abnormality, but only 3% of those findings were actually linked to a treatable condition. That means nearly all of them were normal for age, but still led to anxiety and, in some cases, invasive tests like spinal taps and biopsies. Take George, a 74-year-old retired engineer. He started forgetting names and misplacing things, and his doctor ordered an MRI. It showed some white matter changes, completely normal for his age, but the results sent him spiraling. He assumed the worst. He stopped driving, stopped going to church. His world shrank. When we tested his memory with a simple cognitive screening tool, his brain function was normal. We explained what the MRI really meant and focused on hydration, sleep, and brain-stimulating activities. 3 months later, George was back to himself, clear-headed, confident, and calm. The bottom line? Unless you're having severe symptoms like seizures, sudden confusion, or major personality changes, an MRI may do more harm than good. A better first step is almost always a paper-based cognitive test, which is quick, affordable, and helps separate normal aging from something more serious. But the next test on our list is one many men are pushed into just because they're feeling a little tired. And unfortunately, it can lead straight to a hospital bed. We'll get into that next.
Checkup number 3, cardiac stress test, a slippery slope for tired seniors. Next on the list is something many older men have had or will be offered, especially if they mention fatigue or a little tightness in the chest. I'm talking about the cardiac stress test. At first glance, it sounds reasonable. You either walk on a treadmill or get a medication that mimics exercise while your heart is monitored. The goal? To check if there are any blocked arteries. But for men over 70 who don't have clear signs of heart disease, this test can often send you down a path you never needed to walk. The problem lies in its accuracy, or lack thereof. In seniors, the false positive rate can be shockingly high. Studies show that as many as 4 out of 10 stress tests in older adults may suggest a problem when there really isn't one. And when that happens, doctors usually order more invasive tests like angiograms, or even place stents in arteries that didn't need intervention in the first place. A 2017 study, published in JAMA Cardiology, found that more than half of the stents placed after stress test referrals were in people with no meaningful symptoms and with no real improvement in survival or quality of life. What they did experience, however, were complications: bleeding, kidney damage from contrast dye, and lengthy hospital stays. Let me introduce you to Raymond, a 75-year-old retired postman. He stayed active, walking every day, but mentioned to his doctor that hills sometimes made him tired. Just to be safe, a stress test was ordered. The results were inconclusive, so he was sent for a catheter procedure. A minor blockage was found, and a stent was placed. But that night, Raymond had a reaction to the contrast dye used during the test. His kidneys took a hit. He spent 6 days in the hospital. Weeks of follow-up care followed. And his fatigue? It never improved, because it wasn't his heart that was the problem. He simply needed better hydration and more frequent rest. Here's the key takeaway. If you're over 70 and not experiencing classic cardiac symptoms, like chest pain on exertion, shortness of breath with minimal activity, or a steep drop in stamina, then a stress test may not be the right move. Safer options exist. A resting EKG can assess heart rhythm without stress or medication. A coronary calcium scan, a low-radiation imaging test, can detect plaque buildup without high risk. These tools are far less likely to push you toward treatments you never truly needed. Now, the next checkup might surprise you. You've likely had it. Your doctor might even recommend repeating it. But after age 70, it may cause more harm than good.
Checkup number 2, colonoscopy, the hidden risks after 70. Let's talk about the colonoscopy. It's been hailed as a life-saving test, and for good reason. When done at the right time, in the right person, it can absolutely catch colon cancer early. But after 70, and especially after 75, the equation changes. Most men aren't told that the risks of a colonoscopy increase dramatically with age. The preparation alone, strong laxatives to clear the bowel, can cause dehydration, dizziness, and kidney stress. The sedation used during the procedure carries risks to brain function and heart rhythm, and the test itself can cause bleeding, bowel tears, and even hospitalizations. In a 2019 study published in JAMA Internal Medicine, researchers followed over 1.3 million Medicare patients aged 70 and older. For every 1,000 colonoscopies done in people over 75, only 2 lives were saved, but more than 20 people experienced serious complications. That's a risk-to-benefit ratio of 10 to 1. Now, even when small polyps are found, they often grow very slowly. In older adults, removing them doesn't always offer a meaningful benefit, and sometimes causes more harm than leaving them alone. Let me share the story of Dana, a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no family history of colon cancer, and had already had 2 clean colonoscopies in the past. But her new doctor, fresh out of residency, insisted she get screened again. So she agreed. During the procedure, a small polyp was removed. That night, Dana experienced severe abdominal pain and fainted. In the ER, doctors discovered a bowel perforation. She was hospitalized for 9 days, lost 10 pounds, and never fully regained her strength. When we reviewed her case, it was clear. This test wasn't necessary. Her prior screenings were clean, and she had no risk factors. She didn't need to go through that. Current guidelines from the U.S. Preventative Services Task Force recommend stopping routine colonoscopy at age 75 for most people. There are safer alternatives for continued screening, like the FIT test, a stool-based test done at home. It doesn't require prep, sedation, or risk, and it can still catch the majority of concerning cases. If your doctor brings up colonoscopy after 70, especially if you've had clean results before, ask about these gentler options, because once you start down the colonoscopy path, it can be very hard to stop. Now, that brings us to the final test, perhaps the most dangerous of all. It's marketed as cutting edge, as preventative, even as life-saving. But what it often delivers is fear, unnecessary procedures, and in some cases, a cancer diagnosis that didn't have to happen. We'll reveal that in the next part.
Checkup number 1. Full-body CT scans, the most dangerous test you don't need. Here it is, the one that sounds futuristic, almost magical. You may have seen the ads. Get scanned from head to toe. Find hidden cancer. Prevent disease before it starts. These are full-body CT scans, often offered at private imaging centers or by concierge health clinics. And for many men in their 60s or 70s, they sound like the ultimate tool for peace of mind. But what they often deliver is just the opposite. Here's the truth. There's no solid evidence that full body scans improve lifespan or prevent disease in healthy older adults. What they do lead to is a flood of incidental findings, spots, shadows, or tiny nodules that are almost always benign, but raise just enough alarm to trigger more tests, biopsies, and surgeries. A 2020 review in the BMJ found that up to 86% of healthy people who got full-body scans had at least one abnormal finding, and nearly all of those led to further testing. Yet less than 1% of those findings were linked to anything life-threatening. And here's what few people realize. CT scans expose you to radiation. A single full-body scan can expose you to the equivalent of 200 chest X-rays. That's not harmless, especially if you repeat it every year just to be safe. Let me tell you about Martin, a 78-year-old widower who prided himself on taking control of his health. One day, he saw a commercial offering a full-body scan for $699. What do I have to lose? He thought. The scan picked up a tiny nodule on his lung, just 4 millimeters wide. His doctor ordered more scans, then a needle biopsy. That led to bleeding in his lung and a week-long hospital stay. The final verdict? It was scar tissue, harmless. But the experience left him shaken. He developed anxiety, insomnia, and a lingering shortness of breath that never fully went away. And he never even needed that scan. Now, let's be clear. CT scans have an important role in diagnosing real symptoms, like unexplained weight loss, coughing up blood, or sudden severe pain. But in healthy seniors without warning signs, routine full-body scans can open a door to fear, not health. The American College of Radiology does not recommend full-body scanning for healthy people, calling it a procedure in search of a disease. So if you're offered this scan as part of a health package, pause and ask, what am I looking for, and what will I do if they find something that isn't actually a problem? Now, my friend, if you've made it this far, you already understand something vital. In the second half of life, more testing doesn't always mean better care. In fact, unnecessary medical tests can rob you of peace, independence, and time. They can turn a quiet life into a carousel of appointments, labs, biopsies, and surgeries, all in the name of prevention. But true prevention isn't about catching every possible problem. It's about knowing your body, respecting your age, and making decisions based on quality, not fear. Remember, medicine is a tool, not a trap. You are not a statistic. You are a man with history, with wisdom, with dignity. You deserve doctors who listen, who explain, and who treat you like a partner, not a project. If you're 70 or older and your doctor recommends a test, ask these 5 questions. Why do I need this test? What are the risks? Are there safer alternatives? What happens if I wait or skip it entirely? How will the results actually change what we do next? And if the answers don't bring clarity or confidence, it's okay to say no thank you. I'd rather not. That's not being stubborn. That's being wise. Let's close with this thought. As we age, the goal of medicine should shift from finding everything to protecting what matters most: your energy, your mobility, your independence, your peace of mind. Choose doctors who understand that. Choose tests that honor that. And above all, choose to live boldly, not fearfully. Your best years aren't behind you. They're just quieter. But in that quiet, there's strength, there's clarity, and there's a kind of health that no machine can measure. Stay strong, stay curious, and never forget, you are the keeper of your own health.